So again, same three questions that the fellows answered is kind of why did you go to the conference? What were your experiences there? Maybe like what panels did you see, or what people did you meet, and what did you learn from it?
Okay. Well, I went to the conference at Harvard because I went to the first conference that we had gone to at the School of Management at BU, and I was impressed with the panel and the speakers and the issues that they were bringing up in terms of like social entrepreneurship. And so I thought that it would be great to go to another one and be, I guess, influenced again in terms of like what really is social entrepreneurship and what businesses are doing in terms of like getting that aspect of business implemented. So it was more for me, going to the symposium was for me more of a teaching tool than anything else.
And what panels did you see, or what kind of events did you go to?
From what I remember, I went to two panels and one contest, or it wasn't really a contest, but more of like an elevator pitch competition.
Mm-hmm.
The first panel I went to was branding, and that was more along the lines of having some kind of social initiative and then using that social initiative to form some kind of like marketing tool. For example, if you remember the Aldo campaign, one person who had led the Aldo campaign to help raise money for HIV, I think it was HIV in Africa or other third world areas. And what they did was they used this concept of a dog tag, and said if you buy this dog tag, then you will help raise money for this social initiative.
Mm-hmm.
And this person talked about how Aldo was all about selling shoes, but how they had to like reinvent the wheel by using dog tags to use as a way of selling and raising money, but at the same time getting business for a company that isn't really about social change, but is in a way indirectly or directly adding to its social responsibility for some form of social change. In this case, raising money for HIV research, for example. So I thought that was pretty interesting because it helped me think of ways that if I wanted to do something along the lines of like forming any kind of business in relation to some kind of social initiative that I had, then I could work with businesses and think on their level, but at the same time get them to think on my level. And I thought that was pretty cool. I had never been exposed to that or learned anything of that sort, and I thought that was a great way to like develop communication with businesses just from going to this one panel. And the second panel, let's see, that I went to. No, actually, I don't think I went to a second panel. I think I just went to like a couple of other talks. It wasn't really a panel, but really what got me was the elevator speech, the concept of the 3-minute elevator pitch. Basically, different groups had a project that was related to some kind of social business, and they had to be able to figure out a way to say what their business's mission is, their motto, exactly what their plan is, how they're going to like keep it sustainable, etc., all within like I think 3 minutes. And what was interesting was that each group that came up and talked about what their project idea was and how they're going to get it to be self-sustainable, each of these individuals were not just business majors, but they were represented from the School of Public Health, from Harvard School of Medicine. Some of them were residents, already done with their medical training, and they were starting up their own way of just getting their projects implemented, started, but still having their own life, doing their own. They were in the beginning of their own careers, and I could relate to each and every one of those individuals. I felt that it is possible to be able to be active in terms of like recognizing something that needed to be done, whether it be setting up a program for high school students and getting them to like be leaders across lands or in other nations, to setting up some kind of like incubator tool. They had this one project where they wanted to create an incubator for babies, but using tools, like using recycled tools, recycled materials from what I remember, and then having that be sent to areas where there's a high need, especially areas in, like, for example, West Africa or other parts of third world countries around the world, who knows. But the point is, these were physicians, students, all different types, all different walks of life, not just business people, implementing these ideas, these projects, and showing that it is possible to do something of the sort without having it make millions of dollars. And I thought that was pretty cool, just seeing that and having people just do something. And I thought that maybe that might be something that I could definitely implement in my own future, in my own life, even today, in terms of like getting a project going, getting it started, and not be too scared or too worried to not do it because I'm a student, a medical student, for that matter.
Cool. Is there anything else about the conference as a whole? Like, what would you tell to your fellow med students or students in public health about why they should or shouldn't go to a conference like this?
I think one thing about, I always start with the positives, right? So going to conferences like these definitely give you an idea that you normally don't learn in school. You're not going to learn in medical school and public health. Just ways that businesses work, or if you're interested in doing any kind of like social change, because that's what we're here for, social entrepreneurship. If you're interested in that level of thinking or that level of operation, I guess, then these symposiums are really good to go to in terms of like learning how people get things started, how people are thinking, what is in, what is not in, etc. Reasons why you shouldn't go, I guess, would be, I can't really think of reasons why you shouldn't go.
Good answer. Right.
I mean, they do cost money.
Here's the check.
Thanks. They do cost money, so if you don't have money, then, that's one reason why you wouldn't go. But other than that, it's not like nothing costs anything. I really don't have a reason as to why you wouldn't go. I think that if you're just truly interested about learning about anything, you should just take any opportunity you have, especially if you have the time to participate in talks, symposiums, gatherings, anything, so be it. I'm never opposed to learning, regardless of what the area is. It doesn't always have to be within the realms of medicine. It can be anything.
All right. Thanks a lot.
You're welcome.